Hello and welcome. I'm Dr. George Lundberg, editor-at-large for MedPage Today, and we're having a conversation today with Dr. Michael Ulrich of Göttingen, Germany. We are in Las Vegas at the annual meeting of the American Society for Clinical Pathology, and I want to talk to you about your role as the president of the WASPALM. WASPALM? What is that and what does it do?
WASPALM is the World Association of Societies of Pathology and Laboratory Medicine.
Okay.
And our mission is to promote pathology and laboratory medicine in the field of education, research, practice, and commerce.
Okay, how many countries are represented in WASPALM?
We represent 45 countries in 34 countries across the globe.
Okay. All continents?
Yes, all continents.
Okay. And you have meetings?
We have biannual world congresses,
right,
like the one here in Las Vegas.
Well, you're having that right now?
Yes,
okay,
right now. And in between we have bureau meetings, we have educational workshops in countries in need. That is why I was very impressed last night when I heard what President Clinton does, and this is very much along the line that we work.
Do your meetings work in English, or are you in multiple languages?
Of course, our members have multiple languages, but the meetings are in English.
The meetings are, okay. Well, congratulations on that role. I hope that works well for you. Now let's talk about laboratory medicine in Germany. What is its status? Is it a commodity? Is it a professional service? Is it a research enterprise? Is it commercialized? Is it all of those things? What is its situation?
I think that's an excellent question. Basically, laboratory medicine is an academic discipline. The only problem is that as we see the consolidation of the laboratories, of course, we enter into a phase of transition. On the one hand side, this is very beneficial as we reduce costs. On the other hand, we must be careful that policymakers do not get the impression that this is a commodity. As you mentioned, it is not. So in the future it will be very important to preserve the academic part of it, the research, which is very important, I think, the education, the teaching, and also the professionalism of individuals who work in this discipline. On the other hand, due to the economic pressure, it will be more and more important for the young residents to acquire economic competence. Probably they may need to consider an MBA degree as part of their career in the future.
Because they'll be running laboratories. You don't need an MBA to help take care of patients, but you might need an MBA to run laboratories in an efficient, effective manner, I gather.
The huge laboratories. I give you an example.
The big ones, yeah.
In Berlin, they had a merge of the Charité, the leading university hospital, and Aventis, and they cover now 12 hospitals, and they have about 25 million analysis per year, and they hired business people as CEOs for the laboratory platform.
Right.
And the former director of the laboratories at Charité is now only a scientific advisor.
Well, at least it's the word science is in there. That's kind of nice, but I don't like that word advisor because that's just advisor. Now I want to ask you a question. You probably can't answer this because it applies to those dozens of countries and dozens of organizations. But to the extent you can answer it, to what extent do you think the members of WASP's organizations, which is thousands and thousands of laboratory medicine and pathology people, to what extent are they helping guide practicing doctors to order the right tests and to interpret the results correctly and to act upon those results in a manner that's most consistent for improving the patient's welfare?
Yeah, I think this is a very important question. Pathologists and laboratory physicians should be leaders in medicine, and they should be good consultants.
I agree with you, but to what extent are they in any of those countries? Could you point to a country or an organization that really does believe what I was just talking about and asking you, and actually puts it into practice?
I think it is surprising if you look at countries even like India or South American countries, the emerging countries, that you find a lot of excellent professionalism there. The main problem, as Bill Clinton pointed out last night, are the rural areas, the places where you don't have the experts. You have excellent laboratories in New Delhi, in Sao Paulo, in Belo Horizonte, and all over the world. But the problem is the rural areas in China, India, and in particular in Africa. And there, I think, a lot of things needed to be done, and I was very pleased to hear this morning that the ACP is very active in this field, and our World Association has also these educational workshops and now this visiting lecturer program, and I think this is a very, very big task for all of us to improve this.
Okay, well, I think that's a good note to end this discussion with. Thank you, Dr. Michael Ulrich, for being with us today, and thank you for tuning in. And I'm Dr. George Lundberg, editor-at-large of MedPage Today, signing off.